afternoon. My name is Jill Batika, and I'm accompanied by Maybelline Vitas. We work in the insurance and billing department at the Student Health Clinic at the University of California, San Diego campus. We're happy to be here today with you to go over some important time-sensitive information regarding your health and healthcare coverage that you'll come across in your educational journey at the University of California, San Diego. So before we begin, and during this webinar, you are in listen mode only. Again, we are recording and we'll save this presentation so that you can view it later. For any personal or specific questions about your individual situation, please email us at ship3@ucsd.edu or visit our website to find some good resources. To ask questions, please enter them in the Q&A feature. The chat is disabled during this presentation. We're hoping your question will be answered within our presentation. We'll answer posted questions throughout the webinar, or we might save it for the end where we'll answer that live after our slide deck.
Before we start, we're going to go ahead and turn off our cameras. That way you can focus on the slides, and we will pop back up right after this presentation. So over this hour, we will go over the health insurance requirements for the University of California campuses, the student health clinic on campus that all students have access to, one of the mandatory registration fees, known as the health fee for UC SHIP. We'll also discuss the benefits of this plan. We'll discuss students who already have health coverage and want to opt out of UC SHIP. We'll discuss RAFT, which is only offered if you waive out of UC SHIP. I'm going to go over some common student health financial scenarios, and then we'll be happy to answer any questions that you have. And we hope to provide you with some helpful information to make good healthcare decisions while attending UC San Diego. With the university's requirements and many health plans out there, the Office of the President decided to link forces with Anthem Blue Cross several years ago and created a comprehensive health plan for UC students. And that plan is called UC SHIP. This is an acronym for the University of California's Student Health Insurance Plan, and many schools are implementing a school plan. However, the University of California has been doing this a long time. You may ask why? Well, it's to protect the students and the campus. What makes UC SHIP so special is that this plan is built for UC students with the students actively involved in its design. UC SHIP does provide high quality, affordable, and convenient coverage that protects students from unexpected healthcare costs. So if you live closer to one of the other UC campuses, you can be seen at the student health clinic just like ours. There is worldwide coverage, so if you're thinking of studying abroad, we recommend you take that trip. And the cost of UC SHIP is determined based on the student usage in the last academic year. So for the 2025-2026 academic year, the cost for UC SHIP for undergraduate students is $987 per quarter, and for graduate students, it's $1,940 per quarter. You'll want to times that by 3, and that equates for the health fee for the academic year. And for UC SHIP information, such as the plan documents and referral process, please check out myucship.org, or you can use the QR code. Accessing care at Student Health Services can be obtained by all registered UC students. So all UC students are welcome here, as we are the primary care and urgent care clinic on campus. The Student Health Clinic is open Monday through Friday, year-round, including during the summer. Student Health becomes your primary care home if you do have UC SHIP. So if you're not feeling well, if you need preventative care, vaccines, lab work, or even prescriptions, you want to come to Student Health. We do offer the most affordable prices for these services. Students from other UC campuses, again, can use our clinic with the same benefits system-wide. And the Student Health Clinic is only available for registered UC students. We're not open to the public or for UC staff. So appointment scheduling and availability for students is typically really good. Students can schedule their appointments by booking their visit through their My Student chart by calling the main line, which is 858-534-3300. Please save this number as it is the nurse's advice line where you can speak to a registered nurse to seek advice after hours, regardless of what your health plan is. Please note that Student Health only bills the UC SHIP insurance carrier. That means we don't hold contracts with outside insurance companies. So students with SHIP or RAFT may still use the clinic on a fee-for-service basis. Payment is due at the time of service, or charges will be transferred to your student account. Upon request, we'll provide detailed receipts to help you submit claims to your own insurance. And physician visits at Student Health typically cost about $89 to $159 depending on services provided.
All UC system students are welcome to use the student health on campus. However, RAFT and fee-for-service students are not required to. Here's an overview of the costs associated with a visit at student health, which can range from $49 to $150 depending on services based on the type of payer. For the UC SHIP students, if you are enrolled in SHIP, your services at Student Health will be billed directly to the SHIP Health Plan, which is managed by Anthem Blue Cross. The only out-of-pocket expenses at Student Health would be for prescription copays or over-the-counter items, which can be paid for with a credit card. If payment is not made at the time of service, charges will be transferred to your student bursar account later. For our RAFT students, if you opted for RAFT when filing your health fee waiver, you'll be charged the $70 RAFT fee per quarter, along with over-the-counter items or any services not included in scheduled medical appointments, lab services, or x-rays. For our fee-for-service students, if you waived the UC SHIP and did not choose RAFT, you will be considered a fee-for-service patient. As we do not have agreements with external insurance companies or Medi-Cal, you will be financially responsible for all services rendered at the Student Health Clinic. For students with RAFT or those classified as fee-for-service, itemized receipts can be provided for reimbursement from your home insurance. RAFT and fee-for-service students should use their home insurance for specialty or hospital-based services and prescriptions. Please contact our department or your insurance provider for further guidance. Let's go over the benefits of the UC SHIP plan and the student health insurance plan. The medical portion of the UC SHIP plan is managed by Anthem Blue Cross and the University of California, and Anthem have designed this three-tiered system of coverage for our students. Under the UC providers tier, using UC providers and facilities, students are guaranteed to maximize their benefits and will save more out-of-pocket expenses. There isn't a deductible under this tier, and we have 3 acute UC hospitals in the surrounding neighborhood. If you go to a UC provider, a specialist, it will be a $10 copay each time you go visit them. A referral is required from Student Health before accessing care outside of the Student Health Clinic. As long as you have a referral, then services at the UC system will be covered at 90%, leaving you with 10% coinsurance for any hospital-based services like an MRI or a CT scan or hospitalization. Under the second tier of benefits, that's the Anthem network of providers. That means that you've received a referral from Student Health and you're going outside to see a specialist or you use a hospital-based service. And this provider is an Anthem network contracted provider. They are not a University of California provider. Using the second tier of benefits means that you're not going to a University of California provider or facility, but you are seeking care with an Anthem Blue Cross PPO contracted provider. You can find providers by calling Anthem at the 866 phone number provided or using Find a Provider on the anthem.com website. This requires a $500 deductible. Under the third tier of benefits, again, you've received a referral from one of the providers at Student Health, and you're going to a private practice physician specialist or a hospital that's out of network. That means they don't hold a contract with Anthem Blue Cross. This is the highest out-of-pocket experience under any insurance, so we highly discourage it. This requires a $1,000 deductible to be satisfied before Anthem will pay any claims. After the deductible is met, the student will need to submit claims to Anthem, and they will be paid at 60% of billed charges, leaving you with an additional 40% coinsurance to pay. Student health referrals are still required prior to scheduling appointments, regardless of your distance from our campus. Students outside of the campus area may call Student Health to achieve a telehealth visit or request a referral for primary care or specialty care in the zip code you're currently staying in. Using the Sydney Health app or contacting Anthem Blue Cross directly would be best to get a list of contracted providers in your area. Under the UC SHIP offering, you are getting medical care and mental health care unlimitedly, and you also will receive supplemental coverage for dental as well as optometry. So UC SHIP gives enrollees a supplemental curative dental plan provided by Delta Dental PPO. Delta Dental PPO will provide UC SHIP members with 1,000 US dollars worth of coverage for teeth evaluation and cleaning, filling, x-rays, root canals, and tooth extraction. As long as you're utilizing a Delta Dental PPO provider, you can maximize your benefits. To find a dentist, you would contact Delta Dental at their 800 number or go on their website where you can find more information and providers. A referral is not necessary for dental care. We don't have dentists on campus because we don't have a dental school here. Under the plan, you are allowed one routine eye exam per benefit year, and Anthem iMed will provide you with 120 US dollars to apply towards frames and lenses or contact lenses once per benefit year. To maximize your benefits, please call our UCSD Student Health Optometry at 858-534-2602 to schedule an appointment. If you do have questions about other contracted providers or about your benefits, please contact Anthem at the 1-866 number provided, and they will help you. Again, there is no referral necessary for dental, vision, or emergency room care.
For mental health and behavioral health services, we collaborate with the Counseling and Psychological Services on campus, known as CAPS. CAPS operates multiple locations across the UCSD campus and also offers telehealth appointments and after-hours support. All registered students have access to CAPS, and if you do have UC SHIP, you'll need to secure a student health or a CAPS referral before obtaining off-campus care with these providers for additional assistance. We do recommend you take a look at the CAPS website and explore and access some of the free mental health resources available to our UC students. And to contact CAPS, you may call them directly, schedule an appointment through the My Student chart, or even walk in person. And just a reminder, referrals from Student Health and CAPS are required for any services off campus, with the exception to an urgent care, an emergency room visit, dental care, or vision care. And if you are away from campus and need medical care, please contact Student Health for the appropriate referrals needed prior to scheduling the appointments. The university is trying to be as ecologically minded and no longer mails out hard copies of insurance cards. So starting September 22nd, students can access their electronic insurance card by downloading the Sydney Health app, which is managed by Anthem Blue Cross. Now, this app will provide you with a front and back copy of your insurance card, and it will allow you to view claims processed under your Anthem subscriber ID. The Sydney Health app also allows you to look up providers and facilities contracted with Anthem Blue Cross, wherever you are. And for the next section of our presentation, we'll focus on students that have their own health insurance and would like to waive out of the school-offered health insurance. For students that have their own health plan that meets our health fee waiver criteria, please fill out a waiver application on the Triton Link account during the open waiver timeframes. The application is now open to students through September 14th. You can please use the QR code or log on to the website to ensure that your insurance will be approved. All waiver communications will be sent to the student's UCSD email. Once the waiver application is filed, it takes approximately 7 business days to be reviewed and to deliver a decision. Now, if you are denied, there is an appeal process. If your insurance does not meet the waiver requirements, you will be denied and you will have to pay for the UC ship health fee. We have lots of helpful information on our website for the waiver. We do recommend taking some time to make a good, informed decision about your health care. Waivers are not accepted outside the waiver timeframes. No exceptions are allowed. This slide shows you how to locate the waiver application, where students can log into their Triton Link account located under the financial tools. You will need to read the questions and answer the best you can. A front and back copy of your insurance card, along with a summary of coverage and benefits, is required, which is no more than 10 pages. You'll actually upload a copy of those documents on the waiver portal. One of the most common reasons why a waiver is not approved is if the student has an HMO plan and their primary care physician is over 40 miles away from campus. Now, if you have a non-San Diego County Medi-Cal plan or an HMO plan where you can't update your primary care physician closer to campus, you will have difficulty with the waiver process and will need to see care with UC Ship. UC Ship will be required. And when students submit their online waiver application, an email from AHP is automatically sent to the student, notifying them that their waiver application was received. You will want to keep that for your records in case any issues arise.
If you choose to waive UC ship, I highly recommend enrolling in RAFT. RAFT is an acronym for the Reduced Access Fee for Tritons. It's available only to students who waive UC ship and have their own insurance. For just $70 per quarter, RAFT offers unlimited scheduled primary care physician appointments, in-house lab services and x-rays, flu shots, and is a convenient on-campus healthcare option. No need for rides or off-campus appointments. RAFT gives you peace of mind with a predictable cost structure, a flat $70 quarterly fee. Without RAFT and without UC ship, single visits could cost around $160 each time you come into the student health clinic. As a parent, I'd absolutely have my student waive UC ship with my employer covered insurance, and I would sign them up for a RAFT without hesitation. Should you need specialty care or medication, our team will guide you through the next steps.
I've been at Student Health Insurance for about 8 years now and wanted to provide a few common scenarios that we see at Student Health with regards to students and their financial responsibility after being seen in our clinic. We think it's important to know this for a few reasons. One, to avoid unnecessary costs, to help you understand what's covered under your health plan, uh, to always be prepared for emergencies, as it's a really expensive lesson to learn. And lastly, do your future self a favor and learn about your health plan before you need to use it. It will save you a lot of time and reduce a lot of stress. So, as a reminder, student health can only accept UC SHIP as a form of insurance, and student health is the first stop to your medical care. There is a referral requirement. Referrals are needed for off-campus care for students with UC SHIP. Now, if you waive and opt in for RAFT, you can schedule unlimited student health appointments at no additional cost but the $70 fee per quarter. As Jill mentioned, it is great for preventative or minor care, such as waking up with a sore throat or even pink eye. And if you waive out of UC SHIP and don't elect RAFT, no worries. We can still see you at Student Health. You'll just be paying out of pocket 100%, which is still guaranteed lower costs than facilities in the community. And so now I'll go over a few scenarios. Um, we'll start with scenario one. We have Jerry, a UCSD student who lives on campus and woke up one morning with a sore throat, a cough, and mild fever of 108 degrees. He's concerned it might be strep throat or the beginning of a flu. Jerry contacts Student Health and was able to be seen for a same-day appointment. Dr. Lamar evaluated Jerry and recommended rest, fluids, and over-the-counter medication, and possibly a COVID strep test. Now, if Jerry had UC SHIP, the appointment and tests are covered at 100%, and Jerry only has to pay minimal for his over-the-counter medication. If he had RAFT, his appointment at Student Health would be covered, and then he would be responsible for the over-the-counter medication. So if Jerry came in and was seen under fee-for-service, he would be responsible for all of the fees which could be up to $150. All of that includes the test, the over-counter medication, and there is no discount for Jerry. However, he can ask for an itemized statement from the Student Health Insurance Office, which we will provide. Hopefully, he'll be able to seek reimbursement with his insurance plan. Now, for scenario two, Raina has been experiencing frequent sneezing, nasal congestion, itchy eyes, and occasional shortness of breath, especially during the spring and fall. Over-the-counter meds are no longer effective, and her symptoms are starting to affect her concentration and sleep. Raina contacts Student Health to schedule a primary care appointment, and Dr. Walters suspects that she has allergies and refers her to see an allergist for further evaluation. If Raina had UC SHIP, the appointment at Student Health is covered at 100%, and Raina only has to pay $10 for her copay to be seen with a specialist at UCSD Health. She'll also be responsible for 10% of the services if rendered. Now, if Raina had RAFT, her student health appointment would be covered, and she will then be advised to contact her health plan to see how she can see a specialist covered under her insurance. At that point, the referral is only a recommendation. Lastly, if Raina was fee-for-service, she would be responsible for all of the fees. There's no discount for care. However, Raina can ask her insurance if she can be reimbursed, and we'd be happy to provide that itemized statement. Now, on to the last scenario. We have Daniel, who loves riding his electric scooter on Library Walk. Side note, UCSD is a great campus. It's beautiful. There's a lot of walking, a lot of scooters around, a lot of students on bikes, so you'll want to keep in mind of that. So, one day, Daniel lands awkwardly on his right wrist and right ankle. There are no signs of a fracture, but both areas are painful and swollen. Daniel is concerned that he might have sprained his wrist and ankle and walks into the student health urgent care. Now, Dr. Chun was able to meet with Daniel and ordered x-rays done inside the student health clinic. Daniel was diagnosed with a moderate sprain in both wrist and ankle and was recommended the RICE treatment. He was also provided a brace and was given a prescription for anti-inflammatory medication. With UC SHIP, Daniel would be looking at no cost for the student health visit. He would be responsible for a 10% coinsurance of the brace and a $5 copay for his prescription. Now, if Daniel had RAFT, he would be responsible for the $20 copay for the urgent care visit. He would be responsible for the brace at full cost and full cost of the prescription at the student health pharmacy. If Daniel was fee for service, he would be paying full price, which is still cheaper compared to the community providers. So, as a reminder for RAFT students and fee for service students, please contact Student Health Insurance for an itemized statement uh, to give to your health plan for possible reimbursement. At the end of the day, we just want each of our students to understand their health plan before they need to use it.
This is a list of urgent care and emergency room facilities near our campus that can help you if student health is closed or you're experiencing an urgent or emergency situation. For your own cost savings, please always try to use the student health clinic for any preventative or routine care. The emergency room comes with a hefty copay of $150 if you're covered under UC SHIP and is reserved for unexpected incidences that require immediate medical care. If you have an urgent situation that you'd like to be seen while our student health clinic is not open, please visit the urgent care on Via La Jolla Drive. It's right down from our campus, within walking distance or a little shuttle ride away. You can schedule an urgent care visit in My Student Chart and see wait times. If you need directions or to talk to a provider, please call our after hours nurse line at 858-534-3300, which is also the nurse advice line. This is a list of important deadlines and reminders. So your next steps, now you want to take the time to decide and choose whether you want to be on the UC SHIP health insurance or if you're going to submit a waiver because every student of University of California is required to have health insurance. Second, if you are waiving, the waiver is now open. It opened on May 12th and it will be open on the Triton link until September 14th. We will reopen the waiver on September 15th. It will be open until September 20th, but there is a late fee of $50 that will be added to your student account if you do file the waiver during that time frame. So please try to file your waiver by September 14th so you don't get hit with that late fee. And then September 22nd is the first official day of our fall quarter. You may not start classes on this day, but it is the official first day of the fall quarter. And if you are keeping the UC SHIP, this would be the first day that you're effective under our plan, and you could download that Sydney app so you have your insurance card on hand at all times. Please again consider taking that RAFT, which is not insurance, but it is a membership to come into the student health clinic. paying $70 per quarter to have as many visits at our student health clinic, lab services, and x-rays as you want during a quarter. And again, waivers will not be accepted after September 20th for the fall quarter. We do open up the waiver about a month before the winter and spring quarters, so you can file it if you missed that period, but we don't retroactivate the waiver and we don't accept any late waivers. Thank you for spending time with us today. I'm happy to dive into your questions now during the Q&A. If we don't get to everything, please feel free to reach out to us at our email, ship3@ucsd.edu, or join one of our Zoom sessions. We're always here to help. Follow us on social media and don't hesitate to say hello if you do see us around the campus. May and I are wishing you all the best during your time at UC San Diego. So we're going to put ourselves back on camera and we're going to answer any questions that you have. Hi, May.
Okay. Hi, Jill. We have a few questions. I'll start with if my healthcare provider is Kaiser and my primary care provider can be switched to one closer to campus, what are the steps to successfully waive UC ship?
So we accept Kaiser. We know that it's very big in California, and a lot of that goes on in Northern California. You will have a Northern California medical record number under Kaiser, and all you have to do is contact the member services phone number at Kaiser to secure a Southern California medical record number. So while you're here down in San Diego, you would be able to use that medical record at any of the Kaisers. I do need to caution you that the nearest Kaiser is about 15 miles away from our campus. So if you are sick or not feeling good and you have to go to the doctor, you're going to have to navigate the streets of San Diego to get to that provider while you're not feeling well. So in that case, I would strongly encourage you to pick up a RAFT. So at least we could do an initial diagnosis, get you maybe some over-the-counter items that'll give you some comfort, and then you could make your appointment at Kaiser where they can take care of you and get you to the specialty level or provide any prescriptions that might be needed.
Thanks, Jill. To piggyback off that, will Medi-Cal in Northern California with the primary care provider in Northern California, Kaiser, count as a qualified insurance to opt out?
So Medi-Cal is a little bit different. Even though it is Kaiser, you are locked into that primary care physician network that you've applied for through Medi-Cal, and it only works in the county that you're operating out of. So I strongly recommend that you get a hold of your county caseworker or contact the San Diego County Medi-Cal offices to start a transfer. It can take up to 45 days to transfer your care from one county in California to the next. So the sooner that you start that process, the better. And you can use our campus address in the meantime if you need an address in San Diego to start that process. Once you get your address and you have a mailbox on campus, you can contact your caseworker and let them know that this is your ongoing address. I know that it's a hassle to have to do all of this, but we want to make sure that you're safe here in San Diego. And the only thing that's available to you under Medi-Cal outside of San Diego County would be emergency room care, and that just doesn't meet our criteria. So you'd have to transfer your care. When you go back home, you'd have to transfer back to the county that you're from. Or you could ask for full scope Medi-Cal and see if you qualify for that.
Thank you. So, do you need to file a new waiver per quarter, or is it effective for or is it effective for the calendar year?
Great question. So when you file your health fee waiver prior to the fall quarter, that's waiving you for the fall, winter, and spring of the academic year. That's a full academic year. If you file your waiver before winter, you're only being waived for winter and spring. If you file it before spring, you're only being waived for spring. So it is an annual process. I strongly recommend that when you register for classes, jump on the Triton link and file that health fee waiver so that you are waived and you don't have to worry about unnecessary charges.
I know that there are many plans out there, but have you heard of a specific plan with Sutter? And are you familiar if it's offered by our ins uh, or if the telehealth option offered by our insurance qualifies?
It doesn't. If you are with Sutter Health and you have a point of service, an EPO or a PPO, a participating provider organization coverage, that's fine. You can file a health fee waiver without any issue. But if you are locked into a Sutter Health HMO, Health Maintenance Organization plan, then that only works in the area that you're living in, and that's usually Northern California. So you would have to contact the insurance company and see if there is a way that you can get assistance as a visiting student while you're attending school outside of your area. And we would have to make an exception for your waiver if you can provide documentation that shows us that you will have coverage while you're in San Diego for primary care, urgent care, emergency room services. We can't approve a waiver using telehealth or just emergency offerings. So please contact your health plan and see if that's something that they can assist you with.
Thanks, Jill. Uh, Someone asked if they filed a waiver without enrolling in RAFT, can they still enroll? And I'm saying, yes, you can. Please email us at ship3@ucsd.edu and please request it prior to the start of the school year. If the school year started, we can enroll you in RAFT the upcoming quarter. Let's see. Oh, this is a good question. Hey, Jill, so the waiver is basically saying no to the UC ship. I think
I'm
that
sorry?
means the I think it's this, they're asking, does the waiver mean we are saying no to the school's insurance plan? The waiver is
That's
basically
right.
saying no
So
to the
waiver
UC ship.
meaning avoiding that charge. Every single student that enrolls and registers for classes is automatically charged a health fee. That health fee is what pays the premium for the insurance. So when you file the waiver on your student account, you'll see a charge when you're registered as part of the registration fees for the health fee. And if you're approved for the waiver, you'll see an offsetting payment that's assessed to your student account. So then your balance would be zero for the health fee. So waiving meaning you're avoiding the school insurance. If you want the school insurance, you don't have to act. You're automatically enrolled. If you want to waive it because you have your own insurance, that's when you got to jump on the Triton link and get that waiver submitted so that we can review your insurance and hopefully approve you and avoid paying that extra fee.
Okay. Are you aware if gender affirming care is covered by UC ship?
Currently, gender affirming care, surgery, medications, specialty care, that is a covered service under the UC SHIP benefit.
And we did hear you say something about EPOs. Does that qualify to waive?
Absolutely. EPO means that you have the versatility of either using a network of providers or picking a provider under your insurance plan, depending on how much you want to pay out of pocket for copays, coinsurance, or deductibles. So EPOs are definitely accepted. The easiest way to fly through the waiver application is if you have coverage through an EPO health plan, PPO, or a point of service. The HMOs, as long as they're centered out of San Diego, where you have a primary care physician in San Diego, or if you have Medi-Cal or Medicaid and you have a San Diego provider, those are the approvable plans.
Thank you. Okay, so there's a question about qualifying life event. If a student has insurance covered through their parent's employer and the parent changed jobs, they have to change their insurance plan in the middle of the quarter. Is that doable?
Yes. So opting back into the ship It's pretty easy. So if you have a life event like a marriage, a divorce, you lose your job, you lose your insurance because a company goes out of business, something like that, and it's in the middle of a quarter, at the beginning of the quarter, and you've missed our waiver timeframes, all of that, what you want to do is go on our website because we have a lot of good information there that can tell you how to enroll and ship if you've lost coverage. And I do want to alert you that when you file that health fee waiver, automatically the company that determines whether you're approved or not is going to validate your insurance on a monthly basis. So the subscriber identification number that you provide is going to be verified monthly. So if you do lose coverage, we generally will know about it and will consult you and find out what you want to do. Because again, the campus cannot allow for a student not to have insurance while they're here. So if you do have a life event and you need to pick up the ship insurance, there's a form called a waiver cancellation or an exception to closed enrollment. You want to file those forms based on your situation. An exception to closed enrollment means that your insurance has terminated, and we need a copy of that letter from your employer or from Covered California or wherever you're buying the insurance from that shows a termination date, and we can enroll you in the ship insurance no matter when it is. The unfortunate part is they don't prorate or discount the cost of the premium. So if you're an undergraduate, it's $987 no matter when you join the ship. If you're a graduate student, it's $1,940 no matter when you join. So I do want you to bear that in mind. We also do offer dependent coverage. So if that's something that you're interested in, take a look at our website. Again, it'll tell you who the qualifying people in your family might be that you might want to cover and how much it would cost to cover them. That's also done on a quarterly basis. So you'd have to purchase each quarter that you want someone in your family covered under that dependent coverage. And I know that May is popping URLs into the chat box. So again, please take advantage and take a look at our website while you have the time. I mean, it's July 1st. The summer's already flying by, but it's really time for you to figure out what you want to do as an incoming student of the University of California.
Thanks, Jill. Okay, so Karina's asking, does UC SHIP cover injuries outside of campus? I'm saying yes, and I'm providing a link to the My UC SHIP website where you can see getting care. It could be on campus, away from campus, globally. It's up to you.
Perfect, May. And yes, this is a
Mhm.
full comprehensive health insurance plan. This isn't just built for those services on our campus, just to have primary care available. This is hospital-based services, mental health, prescriptions, pharmaceuticals. If you need to go have any kind of hospital-based service, diagnostic or inpatient, this plan covers you very well. And again, it's a plan that's built for students with students in mind. So generally, like late 17-year-olds to 30-year-olds, we're looking at adolescent medicine and young adults and adult medicine. So these services are covered under this plan. And again, please take a look at our website because the benefit booklet is provided for you, as well as a summary of benefits. So you can take a look and see if this plan meets your needs, if you have a chronic illness, or if you have any kind of scheduled services that you have to have on a regular basis for your health care.
Awesome. Let's see. And can students access the waiver application now, or do they need to be registered?
I would take a chance. I would try and log in. And if you can't, then wait until the day that you register for classes. Sometimes we are communicating names over to our waiver decision maker. We have about 43,000 students that we're communicating on a daily basis to them that open the waiver door for the student. If you can't access it now, then when you register, your information will go over to that waiver company and you can access the waiver without issue. There are IT links that you can follow up and report any issues that you might have if you can't get into it once you register. But it's a pretty good system.
Thank you. So we actually answered all the questions. Something I
Well, go
wanted
ahead.
to I wanted to add another link. It's for dual coverage. So if a student is going to have more than one insurance plan, it's pretty helpful to coordinate your benefits with both health plans ahead of time. That'll save you a big headache.
And for anyone that is covered by Anthem Blue Cross, we're not the same. It's the same company, but we are the student division. And any commercial plan that's offered through an employer group or through Covered California, or if you're purchasing it directly from the health plan, is considered a commercial plan. And that's not the same as our coverage here. So we would not be able to bill your Blue Cross insurance. We can only bill Anthem Blue Cross for the student division coverage. We do fall primary in payment to Medi-Cal and Medicare, veterans benefits and commercial plans or private plan insurance plans would be primary, and we would be secondary for any other services that you obtain. When you come to the student health clinic, if you're SHIP, we're going to build a SHIP. We're not going to worry about any other insurance. So please do keep that in mind. And we have just about 30 providers here, medical doctors, nurse practitioners, and registered nurses that are experienced and have been around for a long time taking care of adolescent medicine and young adults. So take a look at our website. It'll tell you all the services we provide, and it also provides the resume of our physicians and our medical care team. So hopefully you can get some good information and make good decisions about how to take care of yourself while you're a student here. All right, so if we don't have any more questions, we're going to wrap this one up. We have many other webinars of the same nature that we do provide. So if you want to tune in again, please do so. The registration form is on our website. Or if you know somebody that might benefit from this information, please let them know. And again, this recording will be stored on our website a little bit later so that you have access to it for any kind of resources you might need. We wish you the very best while you're here in San Diego. It is a great place to be, and I hope you have a lot of fun while you're here. And I really thank Maybelline for helping me today with this presentation and asking the questions, and hopefully we'll see you around campus.
Go Tritons.
Thank you.